Good afternoon.
Finished your lunch and the break or not yet?
Yes,
Done already?
yes.
Okay, so
Yes.
good. Keep fresh. Let us start by Al-Kitab. Okay, let us start by the first batch. Who will be?
It will be me, Ariana, as the doctor, and also Aina as the mother.
Okay. And who else?
For the second long TP case presentation, it will be Amir Arif and also
No, I mean for the OSCE and
oh, for the OSCE, it will be continued by Nur Akila, Haikal, and me myself. Adawiyah.
okay,
Okay.
good.
Aina, shall we start now?
Okay.
Wait. Okay. All right.
Just remembering you, you must be professional as if you are in the exam, because your colleague on year 5, when we did for them the exam and shorted it to 10 to 15 times for history, some of them became a bit clumsy. Okay, so take care. You must be able to concise your time according to the situation, especially in clinical practice. If you have a lot of patients waiting, you must be able to pick the most important points. Okay, of course, systematic manner must go ahead and you must catch all the points, but it may be a good selection of the points. Okay, go ahead, Aliana.
Okay. Aina, are you ready?
Yes, I'm ready.
Okay. So, Assalamualaikum. I'm Aliana from Year 5 medical students. So, Madam, are you mom of Fatima?
Yes, exactly. I'm Fatima's mother.
Okay. So, can I ask you some questions regarding your child?
Yes, sure.
Okay. So, how old is she?
My children is Fatima. She's 7 years old this year.
Okay. Does she have any medical illness?
Uh, for right now, no.
Okay. So, may I know how long have you been in the hospital and what brings you here?
Uh, Actually, my children has just been admitted like 2 days ago, and she was admitted due to because of she for 3 days straight, and as a mother, this is actually worrisome for me.
Okay. So, can you tell me more about the fever itself?
She was apparently well until like 4 days ago. She developed a fever in the morning, and out of nowhere, the fever just got so sudden, and she's been resting in the couch for the whole day.
Okay. So, did you record any temperature?
I did not. I did not
Okay, it's okay. Do you notice any
record. I
shivering?
just tapped hey using my hand.
Uh, okay,
Sorry.
it's okay. Do you notice any shivering?
No.
Okay, so for the fever itself, is it persistent or is it fluctuates throughout the day?
The fever, it is persistent throughout the day, and it is as the fever go with feverish at first. Despite I use the cool fever on her forehead, it just continues throughout the day.
Oh, okay. So do you give her any medication to relieve the fever?
I did. I gave her a tablet Panadol, which I got last time. I gave her for about like 3 times a day, one tablet 3 times a day. But
Okay.
it does not resolve at all.
Okay, so the fever is rather like stable, right? Feverish, right?
Exactly.
Okay, so besides the fever, did she complain of anything else?
She complained whenever she swallow, she got a pain. So I guess it's just maybe she's having a sore throat. She also complained of having like a pain in her joint whenever she move her hands so wet, and she complained of having like a headache.
Okay.
And,
So
and I noticed that my children, she easily get tired.
okay. So she seems tired all the time since the illness, isn't she?
Exactly.
So before this, she's active.
Before this, she was really active.
Okay.
Just
So how? Okay. So how about her appetite lately?
she does not seem to eat a lot, but whenever I cook, she ate, but she ate just in a small quantity.
Okay. So how about her urine output? Do you notice any changes in the frequency of her urination?
For urine output, oh, I did not notice that one. I'm sorry.
Uh, it's okay, madam. So does she have any rashes on her body? Did you notice?
Rashes. Yes, she developed rashes on the day three, if I'm not mistaken, where she got the rashes around the chest.
Okay, so can you further elaborate about the rash?
I'm not really sure about it, but I guess that the rashes are about it is characterized as if like it is flat, and it have some like raising feature, but now the rash has already gone. So
Okay, so it's gone already. So is it itchy?
uh no, she doesn't complain about having itchiness around
Okay,
the
and
rash.
and do you notice does it spread to other parts of the body such as the legs or the arms?
No, just around her neck.
Hello?
Hello, yes, just around just around the here, just around the neck.
Okay. I'm sorry, my connection is not really good.
Right.
Okay. So, does she develop any eye pain, or maybe you notice any red eye?
Mm, she had no eye pain, but however, she did complain of having. I noticed that her eyes, both sides, are red on the first day of illness.
Okay. So, is there any discharge?
No.
How about now?
You mean the red eye?
Yeah.
Her red eye? Oh, the red eye already resolved, but I'm not exactly notice when did it resolve, but it does
Oh,
resolve now.
okay, okay. So, does she experience any abdominal pain
Oh yeah, she did complain of having abdominal pain on her first day of admission.
on the first day? So, can you tell me more about how she complained of it?
She complained. Oh, okay. On that day, she complained to me she's having a pain on her right side of abdomen. It was actually it was just sudden, and she said that, but she said she have pain, but she still can walk and talk that time.
Oh, so we can say that it's actually like moderate pain, right? Not severely.
Yes, I guess.
Okay, so did the pain like radiates to other parts of the abdomen?
No, it was just on the right side.
Okay, so how about the pain now? Is it still persist?
As for she doesn't complain anymore about the pain, uh, and I guess the pain is resolved.
Okay, so
And today
today,
got no pain. She doesn't complain any pain today.
okay, so is there any vomiting or diarrhea?
Vomiting and diarrhea, none of them.
Okay, so did you notice that she has like uh breathlessness or it's hard for her to take a breath and if she seems like restless?
Oh no.
Okay. So, is there any bruises or bleeding?
Bruises. There's no bruises, but tell me that she noticed bleeding when she brushed her teeth this morning. There's a bleeding when she brushed her teeth.
Okay, does she tell you how much?
I did ask her, but she said it was not that much because she spit it out after that.
Uh, does this ever occur like before, like this gum bleeding?
So far, I guess this is the first time she had that.
Okay. Does it occur only once?
Yes.
Okay, and for the bleeding, is there like any bleeding anywhere else around the body?
So far, no. Just she complained about having bleeding when she brushed her teeth.
Okay, so all right. So I have few more questions. Is it okay?
Yeah, sure, sure,
Okay.
sure.
So did she do you know did she develop like any fitting, or did she complain of neck stiffness or maybe intolerance to light?
No, she doesn't complain about that.
Okay. So is there any fogging done in your residential area recently?
Fogging, to be recall, I think it's a week ago around my residential area.
Okay.
Mm.
And did you recently go traveling or do some recreational or water activities?
Because it is CMCO right now, so no, you're just staying at home.
Okay. So did you take like any outside food?
No, I'm proud to say I cook every day.
Okay, such a good mom. Okay. So does anyone in the family or her friends at school having the same symptoms as her?
So far, no, because
Okay, so
no, so far no.
oh, all right. So right now, your main concern that brought you to the hospital is
Mm-hmm.
actually her unresolved fever, is it?
Exactly. Yeah, she had unresolved fever.
Okay, so is this the first time?
Yes, this is the first time that she had this fever. Before this, her fever dissolved just 1 to 2 days, and then but right now, just it got prolonged. So it worried me.
Okay, so how is she now?
Right now, as for now, her fever already resolved when she was admitted on the first day of admission. I brought her to the hospital on the first day. The fever has resolved.
Okay, so can you approximately tell me on what time does the fever subsided?
I was not there during that time, but the nurse told me that it was actually yesterday on the first day. Actually, yesterday p.m.
At, at
So I
what
don't
time? 6 p.m.
6 p.m.
Okay,
6
so
6
from
p.m.
then it's about 20 hours now, right? Okay. Okay, so to piece all of these together, the fever resolves on the day of admission. Is it true?
Yes,
Okay, but then she develops abdominal pain and also gum bleeding, right?
yes, you got it right.
Okay, okay. So I have a few more questions left, so I hope you're okay with it.
Yeah, yeah, sure,
Okay, so this is her first hospitalization, right?
exactly.
Is she taking like any medicines other than the medication for fever that you gave her, and does she have any drug allergy that you have known of?
So far, no. I just gave her Panadol, and that's it. There's no allergic or allergic to antibiotics or what, right? No.
Okay, so do you follow her vaccination schedule?
Yes, Alhamdulillah, she completed all the vaccination schedule up to her
Okay,
age.
very good. So, during your pregnancy, did you encounter any like medical problems?
No, I don't have any problem or disease during pregnancy because I enjoy my pregnancy.
Okay, how about your labor?
Labor, I have normal delivery. I give birth to her around 39 weeks.
Okay, and does she develop like any problems or issues following that?
She did. She had jaundice that time, but it was only a few days, and then it resolved completely.
Okay, so she's in school now, right?
No, because since we got this unpredictable CMCO thing, so we decided to homeschooling
Oh,
her.
oh, okay. So what I meant is she's enrolled in school, right?
Yes. I enroll her in school.
Okay, so how is she in school?
As I know, she likes to go to school. She makes a lot of friends,
And can she like follow her curriculum at
and
school?
most of the activities.
Excuse me?
I think she's doing fine. She can read. She can do simple calculation, and yeah, she plays number two at school this time.
Okay, very good. Okay. So how about her daily physical activity? Is she like active, prior to the to her illness?
She has been really active at school. She's an athlete at school. She's been participate a lot in the tennis competition.
Okay, so very
Yes.
fit.
So,
So how
so
about her
I,
meal intake?
she eats she eats 3 times a day. Alhamdulillah, she's not a picky eater. She can she can eat whatever I cooked. So
Okay, so that's very
it's,
good
it's, it's
actually.
fine. So,
Yeah. So does she have any other siblings?
I have my first. She has a sister, which is my first, 11 years old, and also my last child. She has a younger brother, which is 2 years old.
Okay, so and does
So
anyone in the family has any like diseases?
no,
Okay, very good. So is she staying with you right now?
yes, all of us live together.
Okay, so I have last question for you, and it is rather personal. So are you okay if I ask such question?
Yes, yes, sure.
Okay, so do you currently like face any financial issues, or maybe any issues in providing like basic amenities to your children, like maybe electric or water supplies, or maybe transportation issues? Do you encounter any of these?
No, up until now, alhamdulillah, we still can cope with it.
Okay, so thank you so much for your time, madam. I hope your child get well soon.
Yeah, okay, welcome. No problem.
Okay, so to summarize, Fatima, 7-year-old Malay girl, was admitted to HTA ward in view of fever for 3 days. So she was apparently well until 3 days ago when she informed her mother that she has fever in the morning that was sudden in onset, and mother claimed it was a high-grade fever. However, the temperature was not documented. The fever also associated with injected conjunctiva, arthralgia, fatigue, sore throat, and also generalized headache, but no chills nor rigor. She also had reduced oral intake following the illness, and her mother claimed that the fever is persistent and it did not follow any specific pattern in which she is feverish throughout the day. So the fever did not subside until day 3 of illness, which is the day when she was admitted. So on the day of admission, she develops maculopapular rash localized on the chest. It is non-pruritic and resolves spontaneously. And then she also experienced mild abdominal pain. It is sudden in onset and localized at the epigastric region with no radiation. And the mother claimed that the pain resolved on the same day. So currently, she is in her second day of admission, and she complained of gum bleeding that was minimal in amount and occurred only once. So she denied any bleeding in other parts of the body, and mother is unsure of her urine output. Okay, so they live in a dengue-prone area where the last fogging took place about a week ago. And upon further questioning, there was no history of vomiting, diarrhea, breathlessness, or restlessness. There was no seizure, neck stiffness, and photophobia that could suggest meningitis, and no cough tenderness, and no history of recent water activities that could suggest leptospirosis, no eating outside food or traveling. Okay. So I'm done
So
with.
what is your working diagnosis now?
Okay, so for now, my provisional diagnosis is dengue fever, day 3 in the effervescent phase with warning signs.
So how can you prove that?
Okay, so to confirm my diagnosis, I would like to do a dengue serology test. So since this patient, Fatima, is feverish for 3 days, so it is appropriate for me to use NS1 antigen test because it is sensitive in fever less than 5 days. Okay. And I would also like to do blood count, such as to do blood investigation, such as full blood count, to to monitor the progression and also severity of dengue. So in full blood count, I expect the finding would be leukopenia, thrombocytopenia, and also heme concentration, as it is the classical finding that you can get in dengue. And secondly is renal function test. Is renal.
Classical finding in complicated dengue. Simple
Oh,
dengue.
okay. Oh, okay. Okay, doctor. So, for a renal function test, I would like to assess if there is any sign of dehydration because she is not tolerating well. And lastly is I would like to do liver profile because dengue can cause like hepatitis. So I would like just to rule out any liver involvement.
Can do hepatitis or transaminitis.
Oh,
Transaminitis is very simple. Just
okay.
include, okay?
Okay.
Unless it is very severe, if we came to hepatitis, we are going to ICU like that, okay?
Okay,
Mm.
doctor.
Okay, any other investigation?
Hmm. For now, no.
Okay, so good to be diplomatic and said it looks I need to at least exclude the most common prevalence disease in Malaysia, which is dengue fever. But if I got any clue for other diagnosis, I will ask for a specific test, like for
Okay. If
like for that, like even if you suspect UTI, if you suspect because this is a mixed picture. Okay.
okay. Okay.
Okay. So what is warning signs? Do you know?
Huh?
What is the warning signs? Do you know?
Okay. So warning signs include severe epigastric pain or tenderness and persistent vomiting or diarrhea more than 3 times in a day, and then mucus bleeding, restlessness or breathlessness, and laboratory finding of high hematocrit.
Anything more?
Hmm?
Anything more?
Mm,
Okay. So you must be,
okay. Decrease in platelet count.
be ready
Yes.
because this, do you know that the most endemic disease you must know it from A to Z. You must know
Yes.
the typical and the atypical presentation because it is very dangerous to miss that. Okay.
Yes.
What is the type of rash we can see in dengue?
Maculopapular rash.
What is the characteristic?
Flat. Um, white in island of red rash.
So I hope your colleague will let you see it because it's very important and it looks like a diagnostic one. Okay. But at the same time, there is one test you need to see the rash. What is the name of this test for the bleeding?
Tourniquet test.
Yes. Can you tell us what is tourniquet test?
Okay, so
If you don't say, if you don't know, said I don't know. I need to
okay.
revise. Do you know or not?
Sorry, doctor. I don't know the details.
Okay. Who knows the details? Is it all of you are sharing it today, or only
Uh,
who is the one? Who is the one who is not sharing it today with the group?
four of us will share about dengue.
And the
You know,
four with
and four
four with,
will share about in second case.
and how much? How many remaining now? One or two?
Eh,
Four and the four.
no,
Are
everyone has their own role.
no. I mean, my group today. Is it 8 or 9 or
Oh,
10?
nine, nine.
So who is number 9 now? Who is number 9? Who
For
is
the
the one who
first
is not assigned today?
Oh,
case, this is
everyone is
five
assigned.
people, and for the second case, 4 people.
Oh,
Yeah.
So engaged all now. Okay, that's good. So you need to revise the tourniquet test. The other thing, if you found this patient has like the critical dengue, which can be either bleeding or decrease in the blood pressure or decrease in the peripheral circulation, like it started to be tachycardic like that. As you know, we have two types of shock. Do you know what is this shock?
It is dengue, severe dengue with compensated shock and also decompensated shock, where patient can have hypotension.
Very good. So our goal is not to wait until the patient became hypotensive,
Yes.
especially if he is admitted in our side. So what is the plan to manage this patient if you
Okay.
suspect he has dengue?
So since I suspect her to have dengue and she has warning sign, I need to hospitalize her to monitor closely. So first is to admit the patient, and then secondly, we need to assess the hemodynamic stability of the patient. So we need to take vital sign and
Admit first,
also,
admit
Hmm?
first or assess first?
I think in emergency we need to assist first.
Yes, if the patient is in shock, you need to
Yes,
intervene, okay?
yes.
Even
So
you must be
mm,
dramatic, preparing for admission. I'm checking if the patient needs intervention like bolus, like supporting the blood pressure, like that, okay?
yes. So we need to assess the vital and also like clinical parameters such as the temperature of extremities, capillary refill time, heart rate, and also peripheral pulse volume. And also we need to take blood to see the hematocrit level to see if it is increased, because if it's increased, it indicates um, the plasma leakage, and we need so together with hematocrit level, and if the patient has hemodynamic instability, we need to resuscitate the patient with fluid resuscitation, because hematocrit level itself cannot indicate that the patient need fluid resuscitation. It must be uh, paired together with our assessment.
So
Okay.
rapid telex now, what is the treatment of dengue?
So first is for those who need, we need to do fluid resuscitation if there's any hemodynamic instability.
No, if we are speaking generally now, we will say that it is fluid adjustment. Because now they found even if you give over fluid, it can deteriorate the situation. So
Oh,
let's say we need input output. Of course, if the patient
oh
is in
yes,
shock,
yes.
or so we need to fluid adjustment, and it is only symptomatic. We don't do you have any treatment for dengue?
It's
Specific treatment?
no specific treatment. No,
Do you have vaccination?
no,
I think
no.
there is some areas started to do vaccination. Maybe India or Philippines starting because the death there is the highest in the world.
Okay.
Maybe they are trying now for COVID. If they are thinking about our areas, they must do uh, vaccination with time. Okay. How many strain of dengue do you have?
Uh, I forgot strain of
You
dengue.
forgot? Did you read?
I've read it, but I forgot. Sorry,
How
doctor.
many fingers do you have? Maybe four. Okay.
Oh, four
For
serotype.
now, for now they are. I think it is covering one more.
Four serotype, right?
Yeah. If you got if someone got the first strain, he is immunized against the other or not?
No. They will have lifelong immunity to that particular strain, but not to other strain.
It will not affect either positive or negative.
What do you mean positive, negative?
The first attack of dengue will not affect the patient for the next one, neither positive or negative. You said it cannot give any immunity, but it has any negative effect.
Oh, what I read is a patient who has been infected before, if they are infected again, they will manifest like a more severe kind of
Yes.
dengue.
So, so this one need to be processed good with the family. If your baby get the first, it doesn't mean he got immunity. In spite, he may be more susceptible to get complicated dengue with the next one or severe dengue. Okay, so you
Okay.
must take care about that. Of course, if you asked about the strain, there is many lab can do that, but it is expensive and like that. Okay, so let us go for. You're good. Do you know the case before?
This is my case.
No, you are not the mom. The mom told you about the case.
Huh?
Do you know that you are presenting dengue fever today?
Oh, yeah.
Answer the question honestly.
Yes, yes.
Just to deduct give your mark. Okay, okay. So she eligible to get 9, but I will give her 7.5. Your mark is 7.5. In the next time, I prefer the blind one. Do you know in the medical research even there is blind, double
Okay.
blind, triple blind. The one who is going to be examined, let him go without any nose. All of you know, but here no need. So that she will know how to deal in difficult situation. She came to
Okay.
the exam and I introduced her SMA. She became very clumsy what she can do. So you must take breath and think how to do. Otherwise, if she knows, she will not get the benefit of thinking and try to deal with difficult situation, especially in the exam. Okay. Next time, don't inform. And the
Okay.
other group for me, no one informed the doctor, neither the mother nor the other one. All know, but not the one to be tested. Okay.
Okay.
Let us go for your another team, the same team. Okay.
Dr. How Oski. Okay.
Yes. Let us present now OSCE and the differential diagnosis.
Wait, yeah.
Okay.
Can you guys see the slide?
Yes.
Okay. So Bismillahirrahmanirrahim. So we will start with the OSCE for this case. So I shall invite Sis Akilah, if I'm not mistaken.
Hello. Hello, can you hear me?
Yes.
Okay, so I'm going to present about dengue disease next. So basically what you have to know is dengue, the agent is dengue virus. It is born by and the virus are okay. So the virus there's 4 strains, then 1, 2, 3, and 4. While leptospirosis is by Leptospira interrogans, and there are more other strains such as Otomelis, Grifosa. There's a lot more. And the transmission for dengue is vector, which is by Aedes aegypti and Aedes albopictus. While leptospirosis, as well know, it is zoonosis. So it can be from rodents, pigs, dogs, also from cattle. And the transmission is when you are exposed to substances by contact, which is by dermally or mucosal. So you are exposed by the urine of the animal which has been infected with the disease. Okay, as for the clinical features, so these are the clinical features. So basically, both of them have a similar presentation, which is fever, flushing. Both can have rash as well, vomiting, headache, and and they can have abdominal symptoms such as abdominal pain. Also, both can present with hepatomegaly. So the differences are in dengue, the pathophysiology is due to fluid leakage, while the leptospirosis is due to when the leptospira they can settle in liver, in organs such as especially in liver and kidney, and they can release endotoxin, which can cause the presentation. And as for leptospirosis, there are three phases, which is leptospiromic, like severe headache, malaise, myalgia, the suffocation, and also have immunological phase, which is meningism. As for severe, it's also known as Wilson's disease or icteric phase. So in this case, which is severe, patient already have hepatic or kidney injury. They can also have anemia, circulatory. Okay, so this will be the clinical course of these both diseases will be presented later on. So next.
So Akila, I think if you are able to make this extension, I know this from our protocol, which is one of the best book, we mustn't forget it. If you are able to do the most common diseases here, I mean the most common prevalent diseases like chikungunya, like malaria, like myelidosis. I think if you are able to do one like that, you can do one like IB, intellectual preparatory for that. It is maybe a good table, okay? If you are trying to make it for Malaysian only, okay?
Okay.
Continue.
Okay. As for the rashes, so as I've mentioned, both can present with rashes. So for dengue, this is like what mentioned by the doctor, which is the white islands in a sea of red. So the rashes is maculopapular or macular, and the rash is confluent. Okay, which means that it is joined together. And the area is around the face, thorax, flexor, with islands of skin. So that's why it is white. And it typically begins on day 3 and can persist 2 to 3 days. Okay. And on the right side is rash, which is by leptospirosis. Okay, so this rash, actually rash is uncommon in lepto, but it can happen and it is erythematous, and it is usually limited to critical areas. And I have read the strain that is typically presented with this is Leptospira autumnalis. So it can appear on the 4th day of illness. Okay, click. Okay, so the rash characteristic is can be macular or maculopapular, and it can be and it is erythematous, urticaria, and can also be petechial with desquamation. Next. Okay, can someone guess what is this picture is actually want to show? Okay, don't mind. So, click. So this is actually the tourniquet test. Okay, so okay, so this is a part of the WHO case definition. So, it is to mark. It is a marker of fragility. So, because we want to differentiate the patients from having acute gastroenteritis or dengue. So, because you can have abdominal pain, fever, vomiting. So, this test shows that if it is positive, so it is highly suspicious of dengue. So, did any one of you read?
Kira? Apa?
Did any of you know how to do this tourniquet test?
No, I don't know.
So let's learn together quickly. So first of all, you have to take the patient blood pressure, and then you next. Then you take total, and then you divide it by 2. So from example here, 100/70. So then you get the midway blood pressure is 85 millimeter mercury. Then you reduce it until 2 minutes, and then and you count the particle that you can see at the anti-cubital fossa. So if it is positive, so it is positive if there is more than 10 per 1 square. Right. Okay.
Okay, next we have full blood count result. So who want to interpret the result? Can I have you, Amirul? Can you interpret this result? Just make a guess.
Okay, for
You just state whether low or high.
result, hemoglobin is normal, red blood cell is normal, hematocrit normal, and for MCH low, MCV low, MCH low, MCHC is high, and for platelet is low, white blood cell low, neutrophil low, lymphocyte is low, eosinophil low, for monocyte low, basophil also low.
So is it low syndrome? A low syndrome?
What other?
I asked him, is it a low syndrome?
Yes.
So you missed the most important point. Yes, I agree. What is the name of this?
This is full blood count.
No, the name of your diagnosis.
Not
We
sure,
have
doctor.
we have thrombocytopenia.
Mm-hmm.
What is this? Is it mild or moderate or severe?
Platelet is low.
Yeah. As thrombocytopenia, is it mild or moderate or severe?
Mild?
Mild. Up to 100 is mild, 100 to 50 is moderate, less than 50 is severe. This is number one. We have now, what is this white count is very low. What is the name? Alina?
Leukopenia.
Leukopenia. And what about the neutrophils?
Low.
Neutropenia.
Neutropenia.
Also low.
Severe?
I think
It's
it's
mild.
moderate.
What is the mild? What is the moderate? So less than 1500, is it mild? Less than 100, the same like platelet. It is less than 100, it is moderate. Less than, less than 1000. 1500, if less, it is mild. Less than 1000, it is moderate. If less than 500, it's severe. But the most important here is now we are thinking of something known as by what? By cytopenia. I mean the two. In international, they are calling pancytopenia F2. But here in Malaysia, we are using bicytopenia F2 and the ban of the ORCD. but the most important is that the hemoglobin is, or the hematocrit is high. Is it 42?
Oh,
Okay, can you see the discrepancy now? That's why I think I asked you during year 3 to make a simple article about how to interpret full blood count and peripheral blood culture, peripheral blood film or not.
no.
This is the most common investigation you must go through and read once. Okay, it's very, very important. Okay,
Okay.
okay, continue.
So I want to show you that in dengue, usually we have thrombocytopenia and also low platelet, right?
Yes.
All right. Okay. So next. Okay. What is this? What is this, guys?
Rapid combo test.
Yeah, exactly. This is rapid combo test. So rapid combo test is actually a test that we know that it is being used to detect the presence of virus as well as antibody, and as virus and as antigen, which is NS1, and also antibody IgG and IgM. Okay, next.
The issue, which one we are going to use? Is it combo or NS1 and
Combo is a combination of two things, kan, Doctor?
yes.
NS1, IgG, and IgM. Right?
So when you are making a detwinning of this combo,
Not sure.
yeah, usually in the hospital, in our hospital, we are preferring to define the timing of the fever. Less than 5 we are going for, as your colleague present, the NS1. After that, 4 and more, or like that, we can do the IgG and the IgM. And now they make it as a routine in some of KK, because also it can give you idea about the previous infection. If you find the IgG are high and the NS1 now is high and the IgM is still negative, it means the patient, this is a second attack for him. Okay, so there is something to tell you, you must follow up your institute. Protocol or procedure. Okay.
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 So this is basically rapid combo test where, so does anyone want to interpret this result? Okay, it's okay, I interpret this result. So what is C, what is D? C is actually a control line, while T is actually a test line. So what happened is that it is positive when the colored band appear at both, which is control and also test line. It is positive. But if it is only appear at the if the line only appear at the control line, means it is negative. Okay, so it become invalid. The test is invalid when the control line is absent. Okay, as you can see, okay.
What
So
is
in this diagram,
number 2, the color is a bit faint.
it's still positive, kan? We still
Why?
count it as positive, right?
I'm asking you. Positive? Still like positive or weakly positive? I don't know. I'm asking you.
I'm not sure too, Doctor.
You must go and read. Please, any guidance, you must go ahead. And now you have only 1 year to start to practice and 1 year to even you be responsible for searching for all knowledge for yourself. Okay, is there something weakly positive or not? Because there is different colors in it. Okay.
Right. Okay. So okay, that one below there we got if same goes with the antibody. If there's a line, the band at the C and also band at IgM, then it's positive IgM. If the band is positive, there's a line at the constant and line at the IgG, then it is positive IgG. If they're both, it will be both presence of IgG and IgM. If only C, then negative. If none of them, then invalid. Okay. Next. So this is the same like just now, where the preparation to do this is usually they will drop a serum, which could be a blood there, of the blood, and at this area which state as sample. So just drop blood there, and then later on add buffer. Same go with, and the same thing happened to NS1 and so IgG and IgM. So you will wait the result for 10 minutes and read the line after that. Okay, next.
Bismillahirrahmanirrahim. Okay, Assalamualaikum. Can you hear me?
Salam. Yes.
So we are going to talk about the phases of dengue fever. So I would like to open to my friend, can you state the phases for the dengue fever?
Febrile.
Febrile critical recovery.
Okay, yes, correct. And then can any one of you state its clinical issues, potential clinical issue for each phase? Here for the febrile.
Febrile dehydration, critical shock, recovery, fluid overload.
Okay, thank you. So it is correct. So I think all of us need to be familiar with the phases, because based on these phases, we would like to anticipate the potential complication, and apart from that, it will determine what choice of investigation that we would like to order. For example, here, if in viremia, so we would like to see the investigation based on the virus structure, which is NS1. So if it is beyond the febrile phase, we like to see the IgM or IgG. Okay. So can anyone of you guess what phase is this? For what fever? Of what of illness?
Leptospirosis.
Okay, yes, correct. So can anyone of you give the phases that available in leptospirosis?
Acute.
Here.
COVID.
So this first green box, can you give the name?
Leptospirosis.
Sorry?
Leptospirosis.
Spiremia, okay, correct. And then the next one?
Leptospirosis.
Okay, yes, correct. This way. Thank you. Okay, so basically, leptospirosis is very, it is known with its nature, which is biphases febrile illness. And then we would like to see what is, can anyone answer the red box here? These two?
Blood and several spider fluid.
So yes, correct. So leptospira at the week 1, usually it will present in the blood. That's why we call it leptospiremia at the first phase, first week phase. And then the blue box, can anyone answer or fill in the blank?
Cerebral spinal fluid.
Okay, correct. And then from day 4 to 10, so usually the leptospira will disseminate or go into the CSF. And then can anyone answer the last box?
Urine.
Okay, so it is correspond to its name, right? Leptospiruria. So it is almost the same like dengue. So we need to know the phases because based on this, it will determine what investigation that we would like to order, or which I means that the specimen that we take. For example, if within 1 week or below than 7 days, usually we take the culture from blood. If it's 4 to 10 days, we will take culture with CSF specimen, and if it is beyond, we take urine. Okay, so we go to the criteria for dengue. Can anyone answer the first blank box?
Travel, live and travel to the dengue airport area.
Okay, thank you, Aina. Correct. Okay, and then can anyone list out the clinical sign except AJ?
Warning sign ke?
Yes.
I think for warning sign we can remember it by liver HCT. So LI for liver enlargement more than 2 centimeter. V for vomiting or persistent vomiting. E epistaxis or gum bleeding. R for restless or lethargy. Liver. H increased HCT and decreased platelet. And C, clinical fluid accumulation like breathlessness, and also T is for tender or painful abdomen. So that's
Okay. Thank you for the mnemonic. And then can anyone tell me about the type of the severe dengue?
We
Can
have
you add mnemonic during correction of your slides?
Sorry.
Please add the mnemonic during the correction of your slides. You just put it mnemonic like that, okay?
Okay, sir. So I would like to open to this question. Anyone?
Severe plasma leakage,
Okay.
severe hemorrhage, satu lagi severe organ
Severe organ.
organ impairment.
so severe organ.
Okay, correct. So the presentation of the hemorrhage, I would just like to share. Some we present it as epistaxis or mucosal bleeding or gum bleeding, or some even if it is female, some may present with menorrhagia. But since we are in pediatric, we don't expect them to have menstrual. And then for severe organ impairment, the example could be involve the cardiac, respiratory, or cardiac, liver, and also our nervous system, central nervous system.
It is not complete knowledge because to set precocious puberty, if she got this before 8 years, so you still suspect a good portion in some area, especially if the feeding is okay. Like Malaysia, they are eating a lot, can be ministerial age be less than that.
Okay.
So for pediatric, you must ask even from 8 years and above, is there any signs of puberty or not?
Okay.
Okay.
Okay, thank you for the correction. Okay, so can any one of you state the broad categories clinical category for leptospirosis?
we have leptospiremic and leptospiruric.
Not really. That is the phases. The clinical categories. Anyone would like to try more? So if not, so I will proceed. So it is divided into 4. This is based on the leptospirosis CPG guideline, our local guideline. So the first category is mild influenza-like illness. So the child will present with like common febrile illness with like Mossad, myalgia, arthralgia, the coryzal symptoms, And then the second clinical presentation is Will syndrome, which is complicated with organ involvement. So patient can present with jaundice, renal failure, and also can affect the cardiac. And this next presentation is meningitis or meningoencephalitis, and the last one is pulmonary hemorrhage with respiratory failure. So this is the picture for Will disease. Will syndrome. So they have jaundice, renal damage, and also bleeding. Okay.
Okay, so let's move on to the other OSCE, which is hospitalization of children with dengue. Does anyone know the criteria? There are 4.
Presence of warning sign.
Okay, then
Infants.
okay, infancy,
Children with comorbid factor.
comorbid factors. What is that?
Who has like a critical condition, I guess.
Such as diabetes,
Diabetes, hypertension.
failure, yes. And then the last one?
Not sure.
Okay, so this is the answer. Okay, next. Okay, so you got 3 right, which is presence of warning signs, infancy, children with comorbid factors such as diabetes or renal failure, and lastly, social factors if they are living far from health facilities or have transport issues. Okay, so next question.
Thank you. Thank you for this slide. Number 4 for every admission. Don't forget, please, because you will not be a doctor only. Soon you will be a doctor and a social worker. You must be able to judge the situation. If this one is like orang asli and he has only one warning sign, then said, no, I need 2 warning signs to admit. So go home. It is not wise at all. For me, I will consider any children, maybe I will deal him with like infant, okay, or has a morbidity or has a social factor. We have in medicine something known as social admission. It is very acceptable, okay? You will, whenever you are going, what about your subspecialty, you will find social situation can be very, very important, okay? Thank you for this point. Continue.
Okay, next question. Okay, how about the criteria of discharge? Anybody wants to answer except Aina?
I would like to try. First, clinically stable. Dia clinically improve. Second, good urine output. Third, febrile.
Everyone mute his microphone, please.
Okay, so there are a lot actually, but I just asked for 3, right? Okay, so next slide. Okay, so first is febrile for 24 hours without antipyretic, and then clinically improved condition. Third is adequate urine output. Fourth, stable hematocrit level, and the next is actually no respiratory distress and platelet count greater than 50,000 cell per micron. Okay, so this is the last one, which is, can you guess what is the blood pressure for each of the phase category of dengue?
For normal circulation, so by the normal blood pressure.
Yes.
Okay, compensated will be normal systolic. The diastolic is high.
Okay.
For decompensated, there will be hypotension.
Hypotension. Okay, that's true. So next slide. Okay, so for normal circulation, normal blood pressure, compensated shock, you have normal systolic but high diastolic. Okay, and for decompensated, you can have hypotension. Okay.
You must add, sorry, you must come back to this one and write the pulses.
Okay. Pulse pressure.
And yes, pulse is very
Oh,
important because in this compensated, you will find now pulse is increasing. Okay. At the same time, you must say about the perfusion index, like capillary refill time or the peripheral perfusion or cold peripheries. If you put it, it will be more informative, please. Okay, you need the correction for that.
Okay, I'll put it. Okay, that's all. Thank you.
Okay, well done. So you need to make correction, which we speak about. And we need, if you can do the table of the most common communicable disease in Malaysia, which I speak about, to make one table in the same which you did by the one who write the pediatric protocol. Okay. And can alaikum salam wa rahmatullah. You can send this after correction to my WhatsApp. You may give it to other candidate to helping them to approach, especially year 3. Okay. Do you have any questions for the first case? Is it your room, sister? Okay. Do you have any questions?
So far not there.
Okay.
Doctor, I have one question.
Mm.
Okay, so why in compensated shock you can have normal systolic but high diastolic? I'm not really understand.
This is the body mechanism to try to what to tell you. Sometimes they said body his own mechanism for compensation are working. They cannot elevate the systole, but they can affect the diastole. Okay, this is the body compensatory mechanism. They cannot even they said in the blood gas, soon you will able to read the blood gas it may come to you in the exam. If you found like metabolic acidosis and respiratory alkalosis, which is which? I will say it is respiratory alkalosis or metabolic acidosis if I have both inside the blood gas. They said the body cannot overcompensate. He cannot compensate for both systole and diastole at the same time. So he's trying to put, at the time, the heart rate is very high, the perfusion to the organ, to the peripheral organ, to the skin and the capillary refill and all are deranged, and you are not notice that until the patient came to the decompensated. The other name of decompensated is irreversible. Must take care about that. I mean by irreversible, sometimes you cannot reverse it and you will declare the patient die because you just slept or forgot or not concentrated or like that. It's very, take care. I used it to tell that, take care. The medicine is the simplest way to go to Jannah or Nar. If you are doing your work professionally, maybe Allah will be satisfied with you and offer you Ajir and Jannah. And if you are very lazy and not keen and thinking you are working like any other job with your timing and now the time finished, goodbye, or whatever your concept, it is very dangerous. You can miss a patient and you will be asked. And Allah said, وَمَنْ قتل نفسا بغير نفس أو فساد في الأرض فكأنما قتل الناس جميعا ومن أحياها فكأنما أحيا الناس جميعا. Both. as if you make all life or make all died by one person. You are not in need to do a big criminal like juice or like that. For only one, take care, please. Okay. I would like just to remembering you because fever and skin rashes are very important. I need to ask you also to add some rashes of, no one speak about rash of measles, which started to see some cases now, rubella, okay, sleep deficit syndrome, rosella infantum, all this you must include in the rash because it will guide you really for your differential diagnosis. Any fever with rash must put it in our differential diagnosis. Okay, even malaria, what is the type of rash you will see, you need to include all that, please. If you just write in Nelson, I hope you have the Nelson, the latest edition, which is 21st edition. If you don't have, we can send it to you. It is very informative, and there is a big difference between the eldest and the recent edition. And from now and then, you mustn't use all the editions. Books are changing very rapidly now. Okay, so you need to add the other infectious diseases, especially in that time which we started to see a lot of anti-vaccines. Okay, I think that's enough for the first case. Let us go for the second team.
So, Assalamualaikum. So for second case, I will be the doctor and the patient is Haikal.
Okay. I'm not patient but my child.
We will start. Okay, Cik Haikal. My name is Amirul and I am fifth year medical student in UIA. So you father of Safwan, right?
Yes.
Okay.
Right. Okay.
So I want to ask a bit about your child. How old is he?
My child, he is 2 years old now, 2 years and 11 months to be specific.
Okay. And what is the reason for you to bring your child to this hospital?
So I actually bring him to here because last night he passed he having a diarrhea.
Oh, okay. So before I ask in details about that, is there any other symptom other than diarrhea?
The story is last night at around 2 a.m. He was crying, and then after that we tried to feed with the bottle milk, and then he had vomiting, and afterwards when we tried to change his diapers, we noticed there is a loose stool there. So for the diarrhea, if I'm not mistaken, around we changed the diaper around 2-3 times.
Okay. 3 times as you change the diaper. Is it fully soaked or is it just a tinge or a little? The amount of the stool.
For the first episode, it is quite prominent. So I think it's cover all the all the diapers lah. And then the next two is it gradually subsides. It's better compared to the first episode. So the stool it is quite very watery. And also
the color of the stool, can you describe?
the color of the stool is brownish color, and then it is like diluted due to the water.
Or is there any blood? You notice any blood or mucus on the stool? Abnormal blood?
I think there is no blood there.
I didn't get regarding the amount of the stool.
Okay.
Wherefore, is it fully soaked, the diaper? Is it
Uh,
overflow or is just
yes,
half of the diaper?
yes, for the first episode. However, this next two episode is quite okay.
Oh,
Didn't really soak all the diapers.
is this the first episode or your son have a previous episode of this used to
No.
before this?
This is the first. This first time he is sick.
Before I proceed with other question, did your son have fever?
Before that now, but we not the nurse said that record the temperatures at the ED, and she said that it is fever. But at home we didn't notice it.
So how much the temperature?
According to her, around 38 degrees Celsius.
Does he have any sick contact at home?
To be exact, his sister is already admitted to the ward, to the hospital because of having diarrhea, and also I'm not sure what this disease, but he also have a fever with diarrhea. But I'm not sure whether it is due to her or not.
Does he go to outside taking outside food? Person taking outside food?
No, because my wife is a housewife. Usually she cook the food and feed the baby, the child.
Okay. Do you live in Dengue prone area?
I'm not
Any
really.
resident for being in your housing area?
I'm not really sure, but I think no. I haven't seen any fogging activities.
Recent jungle trekking or water activity?
Oh no. We don't go anywhere for the time being.
So, so I want to ask regarding the vomiting. So how many times does your son vomit last night?
It's about 7 times, and if for the amount, it is like 2 cups, if I'm not mistaken. Then since then,
Can you describe more on the character of the vomiters?
the vomiters, it is mainly fluid, and the color is brownish because before he sleep last night, he drink Milo.
Oh,
So mainly fluid lah. Doesn't have much any food particle.
so the color only brown
It's brown.
and the food. No other color.
No.
Any other symptom?
I think
Any other symptom other than what just now this food?
I think I saw him look quite pale, and then I think he didn't he refused to eat. Probably due to, I'm not sure. Sometimes he vomit when we try to feed him. And then I think
Do you notice
not
any dry lips or sunken eye after the vomiting? Because he vomit like 7 times, right?
yes. I think his lip is a bit dry, and then his eye, I'm not sure. No, I think no. I'm not really sure about that. And then in this morning,
For last night, what about
Say, in this morning, before we went
About
here,
his urine output.
his urine output, I'm not really sure. I think I'm not really sure about that.
Other than that, any other symptom that you did not mention?
I think the other thing is probably he looks like less active lah. Before we went here, usually in the morning, like after at 8 a.m., he usually play around with his toy or running around the house. But today he looks very less active and just watching TV.
Oh, and he did not complain any abdominal pain due to the diarrhea. Due to the stool. Any abdominal pain or not?
I'm not sure because he's too young to tell us. Probably, I think I just, if I'm not mistaken, the abdomen looks a bit distended, and my wife had applied some ointment. Nak cakap apa, if I'm not mistaken. But I'm not sure whether it is relieve him or not.
As a question, just now you said that the patient, your son had fever and he had sick contact, but not live in dengue prone area, also no recent diabetes. Does he have any like pain during urination or any other problem during
No.
passing urine?
I think no.
No. Okay. You said that the abdomen was distended. Does he burp or farting a lot? Any farting or burping?
Yes. For sometimes, a few times. Past the flatus. You mean the flatus or what? Hello.
No. Flatus. The abdominal distension due to air or does
I
he
think
like farting or burp?
Yes, after my wife applied the ointment, he passed flatus for several times.
Does he recently change the meat?
No. He for now he take a formula milk, which is Dumex. I think we didn't change since 3 months year old.
I will ask regarding other for past medical history. Does he have any underlying illness? Any previous hospitalization?
After born at 7 day of life, I think he had jaundice, but didn't go. There's no hospital admission during that time.
So he did not have any other illnesses?
No.
From previous hospitalization.
So far, he is healthy.
For drug history, does he consume any drugs or any allergy to food and drugs?
No, he doesn't have any allergy for time being. And then he didn't take any drugs. Okay, sure.
For I was also getting close history, you said just now for you after born he was on this and then for a few days but not admitted.
Yes.
What about during pregnancy? Is there any problem?
I think my wife is just I think healthy. No, there's no much problem.
During labor, any problem during labor?
I think labor it is normal delivery. I think there's no complication at that time lah. just after the birth, for at the day 7, then my child developed jaundice.
I want to ask for nutritional history. How long does he breastfeed?
He was breastfed up to 3 months, and then I think my wife didn't have enough breast milk, and then we continue with formula milk, which is due max at 3 months. And then at 6 months old, we started to introduce some adult food mix.
So for current diet, how does he eat?
So usually he still take the formula milk, which is doing max, and for now he start or take adult food for 3 times a day, breakfast, lunch, and sometimes dinner.
Does he picky eater or he eat anything, everything?
He did
like vegetables.
He didn't like vegetable. He just left it on the plate. We tried to feed, but he didn't take it.
I want to ask for developmental history. For can he jumping and running?
Now he can jump, run. He can even climb the stair, but step by step. Only one step, slowly.
Or can he draw something, coloring?
Not very good. Not very good, but he can hold the pencil.
The way he hold his pencil, he grabs or he pinch the pencil?
Sorry?
The way he hold the pencil,
yes.
Either he grabs or he pinch?
I'm not really sure how to describe it.
Okay. Can he tell his own name?
Sorry?
For now, can he, when we ask his name, for now, your child, when we ask his name, can he tell his name, his full name?
Yes, but quite bad blim.
Oh, can he count to from 1 to 10?
Yes. He already can count till 10.
And for now, can he dress and undress by his own?
No.
Or need help from you?
No.
Does he drive by night or drive by day?
Sometimes I think he didn't. Sometimes he still had bad waiting.
So for immunization history, does he follow the schedule? Or?
Yes. We usually always bring him with each every follow up. I think the last one he was in 18 months, if I'm not mistaken. So far, we follow the schedule.
Any complication after taking immunization, the vaccine?
No, not really.
Sorry, you have only 2 minutes.
Sorry?
You have only 2 minutes to finish your history.
Okay. How many? How about? Can you tell me about you, your wife, and the family member?
How what? Sorry, your voice.
Your your age.
Okay, I am 36 years old.
Sorry, tell me about.
Okay, for my family, I am 36 years old and working as a lorry driver. My wife, 28 years old. She is a housewife. I have children. The first one is 6 years old. Second one is 4 years old, and this my child is the youngest.
Okay. So no current illnesses among the family
I
members.
only had my allergy to the food, and my first child is had eczema with sinusitis. Resdung. I think she had resdung.
Where do you live?
I'm living in Sungai Karang. I live in Sungai Karang with all these 5 family household.
But so your housing have enough basic amenities like the electric and water supply.
Yes.
And the household income monthly.
Around 1,800.
I think that's all. Predicting. So what I can summarize is thank you, Encik Aka.
Okay, welcome.
So from this history taking, what I can summarize is someone 2 years old, 11 months, present to hospital due to vomit and due to loose stool for 1 day duration, and for history of presenting illness. For the loose stool, it start 1 day prior to admission, where her father state that 3 episode of loose stool, and the amount is fully soaked the diapers and also for the first episode, and then become lesser for the second and third episode. For the character of the it is watery and brownish. Otherwise, he denied any blood or mucus. And this was episode of diarrhea or loose stool that mentioned by his father. And for other than that, the father said the child also have vomiting where it is about 7 times, and the volume is 2 cup, and the character is mainly fluid. It is brown, no abnormal color like red or blood, and the content is the thing that the child drink before, which is Milo. And for I asked regarding the severity, where instead the child has a lot of appetite, reduced oral intake, lethargy, and because his father noticed that he become less active, and the lips also dry, but deny any sunken eye, and for for other history. For other associated symptom is the patient also have fever, and it is associated with the sick contact with his sister, which also have the same symptom, which is fever and also diarrhea. He denied any reason for being or living in dengue prone area, denied any younger tracking, resting younger tracking and related activity, and he also denied recent taking of outside food, and also denied any lower urinary tract symptom like pain during peeing. And the father also state that the child passed out flatus after the diarrhea, the loose stool. And for other history, remarkable. That's for.
So what is your conclusion?
Can I proceed or? So for conclusion, for the conclusion that I can give to this child is the loose stool is used due to infectious cause because the patient have fever and he also have seek contact with his sister, which also have the same symptom.
So what is the diagnosis?
And I more suspect acute gastroenteritis. For that's for other causes like food poisoning or parenteral diarrhea, like the father also denied any lower urinary tract symptom, and but I can also due to lactose intolerance because the father said that the child also passed out lactose a few times.
Is it gastroenteritis can kill the patient, or what is the thing which can kill the patient with gastroenteritis?
For gastroenteritis, the thing that we need to worry the most is hypovolemic shock if there is severe dehydration due to the loose stool or vomiting.
So in our level now, it is not accepted not to comment about the dehydration. There is many people has chronic diarrhea. They can still survive. But for a small infant, his body fluid and the water component are very high. If you got acute gastroenteritis, so he will go for dehydration. If it is severe dehydration, what is the complication of severe dehydration? What will happen after severe dehydration?
For severe dehydration, hypovolemic shock and also electrolyte imbalance.
Okay. What else? One organ, if you deprivate it from water, it will fail.
Renal.
Oh, deduct 1 mark from you. He is now in the exam. If you help one in the exam. Okay. So it is very important. The renal is working for 24 hours to excrete urine, and we have a lower limit like 1 ml per kilo per hour, like that. If so, the kidney became dry. So did you ask him about the passing urine?
Yes, I asked the father.
What is her answer?
He said that normal.
How come he is passing stool a lot? So how can he differentiate between urine and stool? It's very important. If you put in your mind that you are asking about dehydration, so you will ask about the signs of dehydrations. Can you tell me what is the signs of dehydrations?
So for dehydration, there are a few things that we can assess, where we can for the more start from up. We can assess for general appearance first, whether it looking or not, and then we can assess the eye, whether it is sunken or not. Look at the lips
General appearance
and look at the mucosa.
Sorry, what is the first point? You will ask about he is thin. I cannot. General appearance. He is.
Yes. Whether the child alert or not, and
alert,
restless.
Yes. Okay. Good. Okay.
Yes.
Then
we can check like I said just now, first the general appearance, and then look at the eye whether sunken or not, and look at the lips and also the mucosa whether it is coated or dry or moist, and then we can check for the vital sign. Where for vital sign like whether the child has, we check for pulse rate, respiratory rate, also blood pressure, and for after that, for CR capillary refill time also can help us if the child is in more severe state, it will increase the capillary refill time, and we also can check for skin turbidity, whether it is skin turbidity at the abdomen, whether it is fully the 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 recall is slow or not, and then we can check for the urine output. We can also assess the severity of dehydration by the weight, the child weight.
Good. So you know that the vital signs are vital, especially the blood pressure, the pulse rate, the capillary refill time. Okay, the extremity, is it cold or not? Also, if the child is crying, is dry or crying with tear, it will give you also a clue. How old is your baby? How
For
old?
this patient is 2 years old.
Did you need to check for the anterior fontanelle?
Oh, for 2 years, usually the anterior fontanelle close.
What is the closure?
It's already closed. I think I no need.
What is the closure time?
Closure time for anterior fontanelle between 9 to 18 months. For posterior fontanelle until 4 months old.
Okay. Okay. That's good.
Sometimes for anterior
So,
fontanelle it can up to 2 years.
sorry?
And for anterior fontanelle, the closure sometimes can up to 2 years old.
Yeah, it is not uncommon. You must rule something, but we are going for the issues 6 to 18, and the extremities we must search for a clue, like early closure or delayed closure. Okay, what is the definition of infective diarrhea?
Infective diarrhea. The diarrhea which present with is evidence of infection.
Like,
For infection, it either can be enteral or parenteral or system. So, for example, for enteral, AGE. For parenteral, we ask regarding pneumonia or UTI or otitis media, also common in pediatric. For systemic, like dengue and also leptospirosis.
so this is parenteral diarrhea, but if enteral, what is the infective enteral diarrhea? What is the most common organisms?
For pediatric, usually rotavirus, virus.
At which age?
Not sure.
Who can answer without deduction? Who can answer? 5th year students. Okay, so you must read this one of the most common causes of diarrhea in infancy is the rotavirus. You must read it please, because it's the top one.
But
How
doctor,
can we prevent? Sorry.
is it less than 2 years old?
Yes, of course. I said it is infancy. Do you have any prevention for this rotavirus diarrhea?
Yes, there is a vaccine for prophylaxis for rotavirus.
Do you know how is it given? And when?
I do not know.
When we are giving this vaccine?
What I know is it is the vaccine should be given, if I'm not mistaken, before 6 months old.
Yes, you are not mistaken. You're correct. Yeah, this is a very important point. There is some international established vaccines which not yet put it in our protocol. Okay, soon, inshallah, it may be there. You must put it in your mind because sometimes it's a prescription. If the family can offer, they have a good impact. Like this rotavirus, it is given by oral vaccines, and it offers really a good protection. Okay, but it must start early from the 6 weeks at 2 doses. The last one must be less than 6 months. Why? Do you know why?
I'm not sure.
It can cause intersusception. They are afraid of intersusception. And they said already the baby is big enough now, he can tolerate diarrhea and the dehydration. Okay. So that is the medicine. I need to tell the medicine is like branching knowledge. It is not one knowledge. One knowledge will deliver another knowledge, and every knowledge will deliver a lot. And you must be able to follow. Other than viruses, do you have what is the most common bacteria?
E. coli. E. coli.
Online.
Salmonella.
What else?
Shigella.
Salmonella.
Shigella, salmonella.
Salmonella.
Salmonella. Okay, so you must go through the infected diarrhea, please, with its all types. You must go through food poisoning, and you must have at least one table guide you what is the food poisoning, what is the timing. If someone got now food poisoning and the first 2 hours he started to have symptom, what may be the cause? If between 2 and 6, if up to 2 days like that, you must suspect the organism and what is the need of treatment of the patient to get canned food. What did you suspect? All this is very important. Okay, because diarrhea is one of the most common cause of childhood death. One of the most common causes. So we mustn't underestimate it. Okay. Time is running now. Can we? I just try to tell you about the importance to be ready. You have the knowledge, Arif. You already have the knowledge, but you are delivering it piece by piece. It is not good. If you have a knowledge, do it like one shot. Don't say tak, and then another tak, and then another tak. It will not count with you. So if you have the knowledge, try to get breath for a few seconds and say what I know and deliver all. Okay? Infective diarrhea can be either parenteral or enteral. Parenteral can be blah, 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 blah. Enteral can be viral, can be bacterial, can be other like protozoal and dysentery. Okay, so I will, if you're thinking about that, it is the same scenario which you are doing during your examination of the patient. If you didn't put this point in front of you, you will forget to ask about important points. You didn't ask the baby has mucus or blood in the stool. You will forget. Is it? You cannot say after that. Is it dysentery or not? Because you didn't touch the specific point. Okay, that is the issue. So I think you have a good knowledge, but you need to do it. All of us like that on the start, but you must be able to concentrate and be energetic to finish the job. Who is presenting now our OSCE?
Me, Doctor.
Okay, let us start.
Can all of you see the slide?
Yes.
Assalamualaikum. So for our hello.
Hello. Yeah. Yes, we can hear
Okay.
you.
So first, Oski, we start with one question. So infant with 4 days history of vomiting and diarrhea, mother has been giving only water for the past 2 days, but now the baby refused to take any liquids. So based on the picture I show you, can you list 2 physical signs that you can see from the face of the baby?
Sunken eyes.
Yes. Next, another one.
The baby looks tired, lethargic.
Yes, correct. So, generally, the patient have sunken eyes and look lethargic, and probably the baby is unresponsive. So, what do you think the degree of dehydration in this child, based on what Amira has explained earlier?
Moderate to severe dehydration.
Correct. So next. So based on this is from the pediatric protocols. It's from the WHO guidelines how to assess children with dehydrations. So based on the table, there's another test for the classifying the degree of dehydration of the patient, which is the skin trigger. Can you guess what's the question marks? What is the difference between the skin trigger of these 3 types of dehydrations? So no answer. So show the answer. So basically, if we do skin trigger, we if the patient goes, which we done at the patient abdomen usually, if the skin goes back more than 2 seconds, we classify as a severe if there is severe hydration. And so this is basically some of the how we test for the hydration status of the patients. We look at the child's general conditions, whether it is well alert or probably in severe, could be unresponsive, lethargic, or unconscious. We can also look for sunken eyes and offer the child fluids to see how the patient responds to the food intakes. And also we perform skin trigger, and based on this, if there is more than 2 or more of the above sign, we classify it based on the table. So next. So this is another way to test for hydration status in infant. We test for the skin trigger. If it is more than 2 seconds, it is severe dehydration. We look for sunken fontanelle and also for dry mucous membrane and also the absent tears when crying. So next. So just for making it easier, you can look for the signs systematically from the head to toe, as just what explained by Amirul previously. So next. So any one of you can probably more common to ORS. Can you answer how to give ORS in children?
Mix
Maybe
the salt. Mix the salt with water.
how much water do you give the we mix it?
A cup or plus.
250.
How of course.
250 ml.
Yeah. And then what do you do after that? How do you teach the mother to give the ORS?
Empty all the ORS into a 250 ml of water and then mix it.
Correct. And next?
Uh, and then like tell the mother to give it like frequent sip to the child.
Frequency. So if baby, we prefer to use bottles or spoon.
Uh, bottle.
Bottle is generally not encouraged. So we probably encourage the mothers to use spoon rather than bottle. Um, if infant, you use spoons, and if more than 2 years old, maybe you just can ask the child to sip from the cup itself. So
Even
the answer.
even if you need even in unit here to prevent the baby confusion between the maternal and the artificial teeth, we are giving him either by searing or by cup, even newly arrived baby. Okay, but if he's a big enough, can use cup or spoon like that. But the issue, please, for your clinical practice, we must put the ORS to be slightly cold. If it is in hot water or in normal temperature water, it is very bad. It has a very bad taste. Do you know the idea? If you are in remote area and you cannot find ORS, how can you prepare ORS? Anyone knows?
Even
If you
even
are
rem-
Hmm?
even remote radio, we can just ask the mother to mix 6 tablespoons of sugar and half tablespoon of salts into a cup of water.
Okay, you see how is the test now? That's why we try to be slightly cold. And the second thing to give it by small cup, small portion. If you give the child, he really is very thirsty and can drink, but if you give him, he will vomit it directly as if you are drinking seawater. Okay, so please consider this one not to be slightly cold. And the second thing, a small portion, even 10 ml, and then after 2 minutes you give another until it try to be absorbed from the intestine. Because many of the failure is because the mother will bring 1 cup of RS and give it to the child, then the response will be vomit and she will come for admission. Okay.
Doctor, can we mix the ORS with milk?
No, they didn't advise for that. For my opinion, the baby will also hate the milk. Leave the milk as if we are not preventing the child to get breast expressed breast milk because it contains a lot of benefit for the child. So don't mix it together. You will get breastfeeding, and in between you are treating the dehydration by small portions of RS.
Okay.
Continue.
Okay, next, who knows what the indications to start intravenous feed therapy? Anyone just guess? Have any
If
idea?
there is a severe dehydration,
Okay, good.
Persistent vomiting. Cannot tolerate ORS.
Good. One more.
Patient in
Unconscious
shock.
child.
Unconscious child. Good. Yes. Okay. Next. Haikal next. This is the list for indication for intravenous therapy according to the pediatric protocols for addition. I forgot to put in here, mildly to moderate dehydration. We can give in the condition if there is a diarrhea more than 100 cc per 100 cc per hour. And the other indication is if the child present with the abdominal distension with paralytic illness. So this is usually due to the cause by some antidiarrheal therapy and complication of hypokalemia. And maybe also due to the and the last condition, if the child have glucose malabsorption, which is this is a rare condition. So next question. Okay. Oh, alamak dah. Satu point. Okay. Tak apa. So we discussed about the colloid vs crystalloid fluid therapy. So here I provide 6 pictures. Okay. So the first one I already provided the answer. It is normal. It is sodium chloride. Everyone knows it is a type of crystalloid. So next one, maybe Hannah, can you give the answer for the second solution?
Crystalloid.
Yes, good. Let's say Ringer's or we call it Hartmann solution is crystalloid type. Next. Adawiyah.
Colloid.
Good. Next, anyone?
crystalloid.
Good. And then the rest of the two?
Colloid.
Right, okay, good. Next. Okay, anyone or anyone who knows can list or just give a few of advantage and disadvantage of colloid and crystalloid. We start with the advantage of the crystalloid.
Longer half-life.
Crystalloid especially is cheap.
Yes, cheap. What else?
Crystalloid colloid. Okay.
Crystalloid. Sodium chloride is a crystalloid.
No allergic reaction.
Yeah, good. Yeah. One more. Why we prefer crystalloid, especially during resuscitation period in the emergency?
Readily available.
Yeah, readily available. Okay, next. How about colloid?
Good volume expander.
Yes.
Longer half-life.
Yeah, good. On the half-life. And the last one is rarely cause tissue edema compared to crystalloid. Okay. What about the disadvantages? Why we don't prefer to use colloid?
Expensive.
Expensive. Good. One more.
Allergic reaction.
Yeah, allergic reaction. And disadvantage of the colloid. Sorry. Colloid. Colloid crystalloid dah.
Large volume required.
Yeah. Okay. Okay, next. I'm so sorry. Actually, I put it wrongly. The color and crystal light. My God, so sorry. I will edit the slide later. So it's color light and this one is crystal light. Okay. Next. So next question is about the fluid deficit and maintenance in hydration pediatric patient. So calculate the fluid deficit and maintenance of following cases. So there is a 12 kilogram child is clinically shocked and severely dehydrated as a result of gastroenteritis. So anyone can recall back about what is the formula for the maintenance fluid therapy? Anyone remember the formula of the maintenance fluid therapy? No one? Okay. We proceed. So, because this child present with the shock symptoms, so in short, to resize, we need to give 20 milliliter per kilogram. So this is 12 kilograms, so times by 20 milliliter, so equal to 120 milliliter. So we give 120 milliliter of 0.9% normal saline. So we give as a rapid IV bolus. But we need to remember that we cannot correct it rapidly because it can cause cerebral edema. So about the fluid deficit, how to calculate it? It depends on percentage of the dehydration, like our colleague Anis presented before. As you can see, this patient is severely dehydrated, so we assume that this patient have 10% of dehydration. So 10 we divide by 100, 10%. And we time by the weight of the patient. Noted that we need to be, the unit must be in grams. So 12 kilogram equals to 12,000 grams. So the final calculation is 1.2 liter. Okay. For the maintenance fluid, so this is the formula that I asked. Okay, first 10 kilogram this formula is applied to children and also adult, isn't it? But it is quite, but it doesn't apply in units. So first 10 kilogram of the body weight, we time by 100 milliliter, and the next 10 kilogram we times by 50 milliliter, and the rest of the body weight we time by 10 milliliter. So as
Sorry, I think they cannot. Is it unavoidable to this recitation? You can just tell us the title of the. We can show it show this one for calculation of fluid deficit. The next slide or
I'm sorry.
the next slide. Just tell us the title of it.
Oh no, this is the last slide.
Okay, okay. So you need to revise this one. Is there any extra slides?
No.
This parameter citation, it is very high. I don't know, is it? Yes. So sorry for that. Yes, yes, it was very high before. Okay. So you must, as your colleague speak, you must differentiate between the fluid deficit and the daily maintenance, and you must put both. Okay. And sometimes you need to do the running also deficit. If there is one more deficit, all this must be calculated and try to be number one soft. Number two, if the baby need any resuscitation, you must give it on the first. Okay. The final point which I need to clarify to you, please. This is one of the most common, like pneumonia and gastroenteritis, one of the most common cases in pediatric you will see, and also one of the most common cases for mortality and morbidity. You must know all details about that from A to Z. Our pediatric protocol have a very important knowledge. We mustn't be forgotten. Even you have the ability to go to any citation in our library, like up to date like that, and read one article, just to go the main lines, and you can select the one which you feel you are shortage in that. Okay, and prepare your mind. Suppose we can put 100 scenario for diarrhea. Just a simple diarrhea with mild dehydration, viral, bacterial, infectious, enteral, parenteral, food poisoning, dysentery, chronic diarrhea, acute diarrhea, can be ulcerative colitis, or can be Crohn's disease, can be, so it is unlimited. Feeding intolerance, malabsorption syndrome, all these are included under the name of diarrhea, under the title of diarrhea. So it is very important, because every time and then you will see different patients. Okay, that's why I need now your mind to be arranged, to be more conclusive, to go deep, not just simple knowledge. You must be able to go more deep, please. Okay, and this is our job, as I told you before. Still, do you have to present anything, or finished already?
No, this last slide.
Okay. Just I need you. Who is the group coordinator for all the batch, not the group? Is it one of you? I need just to plan with the other groups for my teaching to be the same scenarios. One will be a role player for the mother or father, and the other one is a doctor to be examined. The third one will be giving us the art of differential diagnosis and clinical findings, and OSCE together. Okay.
Okay.
Thank you. Hoping we are trying just to decrease the gap between coming to the hospital and sent in front of the online sources. Now we try, everyone is already engaged, and everyone must revise the points. Okay. Hoping inshallah you will not lose your clinical skills, and after a few weeks we'll see you in the hospital again. Okay, thank you, and see you again.
Thank you, Doctor.
Thank you so much.
Thank you, Doctor. Thank you, Doctor.
Assalamualaikum.
Salam.